Welcome back guys. Now in this video let's discuss about glucose titration curves. So what exactly is the concept of the glucose titration curves? Okay, later we'll be discussing about this curve where we are seeing the filtration of glucose and the excretion of glucose and the reabsorption of the glucose. First of all, in order to understand this curve, you need to have some basic concepts. Okay, you need to have some basic concepts. Now see, this first condition, okay, this is a condition number 1 or the condition number A. Here I am talking about a healthy person. Okay, here I am talking about a healthy person. Now if I ask you, what is the normal plasma glucose levels? Okay, normal blood glucose levels. Okay, in a healthy person, the blood glucose levels will be somewhere around 100 milligrams per deciliter. Okay, so in a healthy person, there will be 100 milligrams of glucose per deciliter. Now we all know 1 deciliter means 100 ml. So 100 milligrams of glucose is present in 100 ml. Let's write it down here. 100 milligram is present in 100 ml. So my point is, if 100 milligrams is dissolved in 100 ml, every ml have how much glucose? 1 milligram. So 1 milligram is there in 1 ml of the plasma. Okay, this is something normal. Now we all know that how much is filtered. Okay, how much is filtered? That is a glomerular filtration rate. Every minute the glomerular filtration rate is 125, we know. So how much glucose is getting filtered? Sir, every minute 125 ml of plasma is filtered. Now if 125 ml of plasma is getting filtered means, now in each ml there is 1 milligram. So how much glucose is actually getting filtered? 125 milligrams. So please concentrate. 125. Right now I am talking about the glucose. Here I have written everything about the glucose. So 125 milligrams of glucose will be filtered every minute in all the nephrons. Okay, all the nephrons collectively. I am talking not into one nephron. So 125 milligrams of glucose will be filtered into your nephrons every minute. Okay, so this 125 milligrams of glucose, see, it is coming from the Bowman's capsule, it is coming to the proximal convoluted tubule. Now in the proximal convoluted tubule, what happens? All this glucose, okay, 100% of the glucose will be reabsorbed. We are having enough amount of transporters here. All these transporters, now they will take this glucose along with the sodium. So glucose will be reabsorbed back into the blood. Okay, so what is this 125 called as? This 125 called as a filtered load. So what is a normal filtered load of the glucose? Normal filtered load, okay, the filtered load of the glucose is 125 milligrams of glucose is filtered into all the nephrons every minute. Okay, every minute. So what is the formula of filtered load? You need to know the formula of the filtered load. How much is getting filtered? What is the GFR? GFR is 125. So GFR into, okay, the filtered load is GFR into the plasma concentration of the glucose. Plasma concentration of the glucose. GFR into plasma concentration of the glucose. GFR is 125 and plasma concentration is also 1. So 125 into 1 is 125. So normal filtered load is 125 milligrams per minute. That is something normal. So all the glucose will be reabsorbed. So there is no glucose. See, there is no glucose coming out of the urine. No glucose is there. Now let's talk about a condition where the plasma glucose levels are getting elevated. See, now the patient is little diabetic. Okay, his plasma glucose levels are elevated. Dysglycemias are there. Now, instead of having 100 milligrams per deciliter, now he is having how much? Now he is having 200 milligrams per deciliter of the glucose. His plasma glucose levels are getting elevated. Now what happens? 200 milligrams of glucose is present in 100 ml. So in 200 milligrams is present in 100 ml. So 1 ml contains how much? So 1 ml of plasma, it contains 2 milligrams of glucose. 1 ml contain 2 milligrams. Now how much is getting filtered? The filtration is 125 only. Okay, the filtration is 125. But every ml have 2. So what is the filtered load? The filtered load formula, we know the filtered load formula is, say, filtered load is equal to GFR into plasma concentration of the glucose. So what is the GFR? GFR is 125. What is the plasma concentration of glucose now? So 125 into 2. Okay, 125 into 2. So how much? 125 into 2? 250. So now in this condition, what is the filtered load? Now the filtered load is 250. Okay, the filtered load is 250 milligram per minute. Okay, 250 milligram per minute. So every minute 250 milligrams of glucose instead of 125, 250 milligrams of glucose is getting filtered. See, 250 milligrams of glucose is getting filtering into the nephrons. Now, see, the glucose filtered load is increased. Okay, now this 250 milligrams of glucose is going into all the nephrons. See, now as the glucose filtered load is increased, all the nephrons are not having the same capability. See, usually nephrons, yes, they can handle this amount of glucose, but don't think every nephron is made like, in one way. Some nephrons will fail to reabsorb this much amount of glucose. Okay, now some nephrons cannot reabsorb this much amount of glucose. So what happens? Because of the heterogeneity in the nephrons, some nephrons will start to leak the glucose. They cannot reabsorb all this glucose. Okay, some nephrons will start to leave the glucose. So that glucose will come into the urine. So that's why what is happening? See, yes, glucose will be reabsorbed, no doubt. Most of the nephrons can take up this much amount of glucose. Okay, they will try to reabsorb. But some nephrons will start to fail. So that's why, see, some glucose is coming out in the urine. Some glucose molecules are going to appear in the urine. So now point, when for the first time glucose starts to appear in the urine? For the first time, when you increase the plasma concentration to 200 milligrams. When you increase the plasma concentration to 200 milligrams per deciliter, now at this concentration, now for the first time, glucose will start to appear in the urine. Glucose leaking is happening. Okay, so some nephrons start to leak glucose into the urine. So this is called as threshold for the glucose. This value 200 milligrams per deciliter, this is called as urinary threshold for the glucose. Okay, now after this, let's take more severe condition. Okay, more severe condition where the plasma glucose concentration is now going to 300 milligrams per deciliter. Okay, 300 milligrams per deciliter means how much? So 300 milligrams of glucose is present in 100 ml of blood. So 1 ml of blood contains 3 milligrams. So 3 milligrams is there in 1 ml. So what is the filter load in this condition? In this condition, filtered load is equal to GFR, same GFR 125 into what is the plasma concentration of glucose? The plasma concentration of glucose is 3. So 125 into 3 how much? 375. So now in our condition, the filtered load is 375 milligrams of glucose is getting filtering into all the nephrons every minute. Now comes the problem. See, this filtered load is very, very high. Now this filtered load is very, very high. Up till this value, yes, all your nephrons can reabsorb. Okay. So if you put, now the point is, you are keeping 375 milligrams of glucose into your kidneys every minute. Okay, it's getting filtered. Now up till 375, yes, your kidneys, your nephrons will try to reabsorb. Okay, up till this value, yes, they can reabsorb. But beyond this value, if you increase the filtered load more than this, okay, for example, now you are increasing the filtered load to 400 milligrams per minute. Now what exactly you are doing? Now up till 375, okay. Now what is happening? The extra 25 molecules now, they will come into the urine. So what I am trying to put in your mind is, your nephrons are having a capability to take 375 milligrams of filtered load. Up till 375, they will try to reabsorb. But beyond that value, all the transporters in the proximal convoluted tubule are occupied. Okay, they are all coming into the play. Okay, all are coming into the play. For example, simple. Now imagine you are having a company. Okay, imagine you are having a company. Now in this company there are 100 employees. Okay, in this company there are 100 employees are there. But usually the workload is not that much. Okay, usually the workload is not that much. So in your company 100 employees are there. Usually 25 active employees are working. Okay, 75 are in reserve. Okay, 75 are in reserve. 25 employees are working. Now, whenever workload is increasing, now we will take the reserve employees. Now, instead of 25, 50 will start to work. Why? Because workload increases. Now, if further workload increases, what happens? If further workload increases, you are going to recruit 75. Okay, you are going to decrease in the reserve. And if workload increases to 100, what happens? All your employees are now working. Okay, up till 100, yes, you are having. Okay, 100 employees are working and they are doing the work. Now, if you further increase the workload, now what happens? Now, work cannot be done. Okay, 100 employees are saturated, 100 employees are working, but that extra work cannot be done. So, in the same way, up till 375, okay, up till this value, 375 milligrams of glucose can be reabsorbed, but more than that, no. Okay, so this value, this 75 milligrams per minute, this value is called as the transport maximum. So what is the transport maximum for the glucose? The transport maximum for the glucose is filtered load of 375 milligrams per minute. Okay, 375 milligrams per minute filtered load is the transport maximum for the glucose. Okay, so till that value, yes, glucose reabsorption occurs, but all the other glucose molecules, okay, beyond that value will be going out in the urine, So what are the two important values which I want you to know? Renal threshold for the glucose is 200 milligrams per deciliter. 200 milligrams per deciliter. This is a plasma concentration. Don't forget. That is, if plasma glucose concentration is more than 200 milligrams per deciliter, now glucose starts to appear in the urine for the first time, little bit. But what is transport maximum for the glucose? The value is 375 milligrams per minute. Okay, 375 milligrams per minute. So what is this 375 milligrams per minute? If the filtered load of the glucose is more than 375 milligrams per minute, further glucose reabsorption will not occur because all the glucose transporters are saturated. Now if you look at here, okay, if you look at this graph is called as the glucose titration curve and transport maximum. Glucose titration curve and transport maximum. What we are seeing here? First of all, on the x-axis, okay, first let's see the basic points. On the x-axis, what is given? It's a plasma glucose concentration. Okay, the amount of glucose which is present in the plasma, in the blood. Okay, this is the plasma glucose concentration. On the y-axis, okay, on this y-axis, what is given? On the y-axis, we have given the filtered load. All this is the filtered load, nothing but the filtered load. Simple. Okay, filtered load and the plasma glucose concentration. Now, see, let me ask you. For example, see, this is the blood vessel. Imagine this is the blood vessel. Now, in this blood vessel, okay, here is a Bowman's capsule. Let me show you. Okay, here is a Bowman's capsule and the proximal convoluted tubule. Now, here, the plasma glucose concentration is, see, plasma glucose concentration is 100 milligrams per deciliter. 100 milligrams per deciliter. So, now what is the filtered load? Just tell me. See, if 100 milligrams per deciliter is the plasma glucose concentration. So what is the filtered load? The filtered load is, yes, 125. Okay, 125. Now if the plasma glucose concentration is 200, what is the filtered load? Just now we have seen the filtered load is going to be 250. Now the plasma glucose concentration is 300, for example. Now what happened to the filtered load? The filtered load is going to be 375. That's the filtered load. Now the point which I want you to know is, see, if you increase the plasma glucose concentration, automatically filtration increases or not? Filtration increases. Okay, automatically filtration increases or filtered load increases. So more the plasma glucose, more molecules are filtered. Simple. If you increase here, more molecules are getting filtered. Why? Because glucose is freely filtered. Amino acids are freely filtered. If you increase the plasma glucose concentration, filtration also increases. So that's what I am showing you in this graph. See, this is the plasma glucose. See, if you are increasing the plasma glucose, automatically the amount of glucose which is getting filtered will also increase. Like, it's like a straight line. It is like a straight line. See, if you increase the plasma glucose, automatically filtration increases. Okay, filtration increases. Okay, now after this green, okay, we are having a filtration curve. Okay, we are having a filtration. Point is, see, now itself I am telling you, yes, you are increasing plasma glucose, automatically filtered load increases. Now all this will be reabsorbed? No, to a certain point, yes, reabsorption will happen. But at 375 filtered load, there is no further reabsorption. There is stopping of the reabsorption. Transport maximum, there is no further reabsorption. We will see now. See, now when you increase the filtration, see, when you are increasing the filtered load, yes, initially the reabsorption is also increasing. Okay, see, initially more is a filtered load increases. So initially whatever is getting filtered, please concentrate on this orange curve. Whatever is getting filtered, now it is also getting reabsorbed. Okay, whatever is getting filtered, it is getting reabsorbed. But especially at 200 plasma glucose concentration, what happens? Now at 200 plasma glucose concentration actually 200 should be somewhere over here. Okay, it should be somewhere over here. That's exact value, because see, now for the first time reabsorption is increasing. The reabsorption filtration are not exactly the same. Okay, they are not exactly the same. So now whatever is getting filtered, it's not exactly getting reabsorbed. So little deviation is seen. Means some glucose molecules are getting into the urine. So that's why exactly at 200, see, now the excretion curve is started. Now it started from the 200, excretion curve have started. Okay, see, now filtration increasing. Now reabsorption also increases. See, reabsorption also increases, reabsorption increases, but at 375 plasma, sorry, not plasma, at 375 filtered load, at 375 milligrams, okay, milligrams per minute filtered load. Now at this filtered load, see, now at this filtered load, now this is getting filtered, but now what happens, see, transport maximum is attained. Okay, now please look at here, after this value, okay, I should actually draw it a bit more, like, see, at 375 milligrams, okay, filtered load, now there is no further reabsorption. See, reabsorption is not going like this, reabsorption is not increasing, reabsorption curve got flattened, there is no further reabsorption. Okay, the reabsorption curve got flattened, no further reabsorption. Okay, so these are some important points which I want you to know. And say the plasma glucose the urinary glucose concentration is increasing at 200. Okay, why? Because at 200 for the first time glucose will start to appear in the urine. So the urinary curve, the excretion curve, this blue color curve, excretion curve is starting from 200. Okay, excretion curve is starting from 200. See, the moment reabsorption is flattened, at this value, okay, at this value, see, at this value, now what is happening? There is more and more glucose. Okay, more and more glucose is starting to go into the urine. So excretion curve is now increased. Okay, now excretion curve is increased. Okay, it's going straight up like this. So these are some important points which I want you to know regarding the glucose titration curves. Two important values which are the renal threshold for the glucose. The renal threshold for the glucose is 200 milligrams per deciliter plasma glucose concentration, and the one more important value which I want you to know is the transport maximum for the glucose. The transport maximum for the glucose is 375 milligrams per minute filtered load. Beyond that value, no glucose will be reabsorbed, all the glucose will end up in the urine. Okay, so with this the topic is completed. Hope the video is helpful. Thank you.